Endometrial polyps are benign growths of endometrial glands, stroma, and blood vessels that protrude into the uterine cavity. In some individuals, they could be completely asymptomatic. Symptomatic polyps mainly present with abnormal uterine bleeding, which may include heavy menstrual bleeding, intermenstrual bleeding, and post-menopausal bleeding. In addition, endometrial polyps can adversely affect a woman's fertility. Endometrial polyps could be single or multiple, and some of them may be pedunculated, while others are not. The exact cause of endometrial polyps is not known. However, they are associated with endometrial hyperplasia. Therefore, unopposed estrogen activity on the endometrium is considered a risk factor. Other risk factors for endometrial polyps include use of tamoxifen, a drug used to treat breast cancer, obesity, late entry to menopause, and hormone replacement therapy. Endometrial polyps are relatively insensitive to cyclical hormonal changes. Therefore, they tend to persist in the endometrium and can cause unscheduled vaginal bleeding. They contain hyperplastic foci in 10 to 25% of symptomatic cases. And rarely, they can transform into endometrial cancer. Diagnosis of endometrial polyps can be done with transvaginal ultrasound, hysteroscopy, and saline infusion sonohysterography. Finally, let's come to the treatment. Smaller polyps usually resolve spontaneously and do not require any treatment. For larger polyps, polypectomy can be done under either general or local anesthesia with the guidance of hysteroscopy. Polypectomy will alleviate abnormal uterine bleeding, improve fertility, and exclude the risk of endometrial cancer.